Discharge from inpatient care. Children are discharged from hospital after resolution of complications and return of appetite to continue community-based nutritional rehabilitation. Emerging data suggest that there is high ongoing mortality risk following hospital discharge and discharge from treatment programs. Hence, there is need for discharge criteria guidelines. Procedure. Criteria for transfer from transition phase to OTP. Good appetite. If the patient passes the appetite test and takes more than 75% of the daily ration of RUTF. Reduction of edema to grade 2 or less. Medical complications have resolved. The client is clinically well and alert. There are reasonable home circumstances, and if an OTP program is in operation close to the patient's home. On discharge, make sure that the discharged patients should be referred immediately to outpatient therapeutic care for continued treatment and follow-up. Discharge with 1 week supply of RUTF. Children under 6 months of age should not receive RUTF. If breastfeeding is not possible, provide replacement feeding according to national guidelines. Every patient should be offered an HIV test before discharge. The patients should be checked for immunizations and other routine interventions. The mothers or caregivers should be linked with needed community-based follow-up and support, such as routine growth monitoring. This table summarizes the discharge criteria in children less than 6 months of age and in children that are above 6 months of age. For children that are under 6 months of age, the discharge criteria are: successful lactation in the mother is reestablished, the infant achieves 20 grams of weight per day on breastfeeding alone for 5 days, and the infant is clinically well and alert. For children that are above 6 months of age, the discharge criteria are: appetite has returned, that is, the patient consumes at least 75% of allocated RUTF as observed over a period of 24 hours, and medical complications are resolved or controlled, and edema is resolving. Discharged patients should be referred immediately to outpatient therapeutic care for continued treatment and follow-up. Discharge with a 1 week supply of RUTF. Children under 6 months of age should not receive RUTF. If breastfeeding is not possible, provide replacement feeding according to national guidelines. Discharge procedures from the program. Provide information to the client or caregiver on the final outcome of treatment. Reinforce nutritional counseling. Emphasize the importance of follow-up care to prevent relapse. Discharge outcomes should be documented in the register and on the treatment card. Give health education on when to immediately seek medical attention. For example, if there's high fever, if there's watery stools with blood or diarrhea of more than 4 days, if there's difficulty or fast breathing, if there's vomiting, if the child is weak, unconscious, or is having convulsions, and if there is bilateral pitting edema.